You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. It's a podcast also. Jeannie Roller and I have met a while ago talking about this healthcare dilemma, is what we label it. And today we are going to talk about the costs of healthcare. And everyone knows this. No one wants to hear it. We're going to give a little bit of scenario. Jeannie, I just talked with one of my, with my insurance company. Not going to mention any names, but I was like, the doctor actually questioned what my deductible was. So she said, you should really call them up and ask them. And I'm like, okay, I did. So when I found out what it was, I was like, this is unbelievable now that these deductibles are this high. And the healthcare, the insurance company explained to me, well, the doctor bills for X amount of money. Then because they're a network, they've negotiated a contract with us, so that amount was in half. So it was $500 that the doctor billed for. The negotiated amount is $250, and then they start talking about the 80%, 20% scenario, and that winds up being my $85 copay. And I was like, that's a lot of money. And I don't understand how, and you're going to talk about it, Jeannie, and more, how convoluted this all has become. And I had another friend just throwing it on the table that was a medical coder. And the coding numbers are just astronomical anymore. How many are available? One doctor even laughed at me and said they're going to start charging coding for me walking in the room. And they're just about doing that. Or maybe they are, because now they're charging for you. If you want a CAT scan, you got to pay for the machine.
Right.
Okay.
Right. And there's so much to talk about on this, Cindy. Years ago, I wanted to know why that if an emergency helicopter ride, they say cost $5,000, let's just say. Whether it does or not, that's beside the point, but let's use that number. So they say that they have negotiated it down to $1,000. And then they say the patient is responsible for $500 worth.
Mm-hmm.
Well, what I found out at that time was that other $500 that they had negotiated it down to $1,000, and remember the patient paid $500, so there's $500 there. It really doesn't get paid because of that year they have negotiated with that provider X number of dollars to provide services, and it just comes out of that pot. So I guess the $500 is just cream on top of the cream for the provider. That, like primary care physicians, they will accept so many Medicare, Medicaid patients.
Yeah, they do.
That is because they've negotiated a price for, the number of Medicare patients, for the number of Medicare patients, and they won't go above that because they're only paid so much, and they won't go above it. That's why a lot of times people have trouble finding a doctor if they have Medicare or Medicaid. So it's really wild because you think, oh, how can they do all this savings? Well, it's really not. It's an inflated price to start with.
Right, it is.
But the thing that also came to my attention recently is an insurance company is saying that in order to save money, they're requiring that patients have a primary physician and they make the referrals to the specialist. Now, Cindy, in my little mind, wouldn't it cost more to have another doctor in the line of things, because somebody has to pay that doctor to refer you on to another doctor? Why can't you just go, especially if you have a condition, why can't you go straight to the doctor that you need every year without having to go back to a primary and say, hey, I need to go to my specialist again for my yearly? It is because, we've talked about this before, these insurance companies, they're owning doctors. They own doctors, and that money all stays in one place so that they can say to Medicare, Medicaid, hey, we need more money because we have all this. Yeah.
Well, let's put this in the mix too. Now, a lot of these bigger facilities, medical facilities, have the hospitalist. So here is, and I'm getting off the topic. We'll probably have to do another podcast about this to really explain some of these costs and that. So here you, as the patient, have a history, say, with your primary care doctor. Well, that goes out the window when you go to XYZ big box hospital, because now you're going to use our hospitalist, and they don't have a clue who you are.
Right.
They're reading a chart. They
Yeah.
have no history on you. So to me, that's just a catastrophe waiting to happen, because your doctor has talked with you for umpteen years, hopefully, or whatever, you've gotten the continuity of that kind of care. And now, so this new person, yeah, okay, they're schooled and all of that, but they're just not personally involved with you for any more than, what do you see in 5 or 10 minutes? A lot
If you see a hospitalist, it's all.
Right.
Because a lot of times it's the NPs.
Right. A lot of mistakes can be made in that 5 or 10 minutes, where the other guy, I'm not saying mistakes won't be made. I mean, we're human beings, but the likelihood of that original doctor knowing your whole scenario really is a benefit to you. Totally a benefit.
Right.
So I don't know why that went out the window. I am my opinion, that all has to do with the bottom line of the money, because we can slice and dice this 800 ways, because healthcare, from what I know, has never come down in cost. It just keeps going up. And the care keeps getting worse. And the doctors are spent, the nurses are spent, ones that are trying to do a good job. And the cost is just spiraling out of control. Somebody's getting the money somewhere, but it ain't us, and we're not getting the care in a lot of instances, and we're just keep paying more and more money. And the other thing I want to say that you mentioned Medicare, in my opinion, if you've worked that many years and paid into the system, now you are automatically getting that $184, I believe it is, this year, 2025, maybe 2026, it went up a little bit. Don't quote me on that.
Did 215 or something.
Okay,
yeah.
It's automatic out of your money. You can't go past go without getting them. But if you want real care, you got to pay above that. So now a lot of places, all told, with a drug plan, that's $600 a month. Now you're getting a $1,400 Social Security check. You've worked 40 years, 45 years, and this is the thanks for the health care that you're getting? This is the thanks for you, moving the United States of America forward for the last 45 years with your job or occupation or profession, and now it's costing you $600 a month just to see a doctor? Ridiculous. We should be ashamed. Absolutely ashamed.
And on top of that, Cindy, you have your deductibles that you have to pay, and your co-pays too. So yeah.
Well, traditional Medicare, once you pay that monthly fee, I think you have the one, if I'm saying it right, the one yearly fee, was like $283, something like that, $250. That was it. I could be wrong about that. Again, these are my opinions, but I mean, just some of the pricing and some of what I've heard from friends, it's astronomical. It is astronomical. Yeah. It is not cheap. $500 or $600 to get health care. And if you go with some of the other plans that say they're free, that's when it gets logged up deductibles, out of pocket. I can't even come up with it. The different medications, it's unbelievable. It's unbelievable.
Yeah. Yeah. Well, and the thing is, like this article, this person thought everything was pre-approved and it wasn't. And so they got hit with a huge bill because it wasn't pre-approved in the correct way. And they found out after the fact that nope. And that, Cindy, would hurt really bad.
It is. And you know what? There's another scenario. We'll do another show. Well, maybe we'll do the next podcast about this to continue on. How do we know, us personally, as the patients, we're sick? Maybe somebody in our family or friend will try to help us. You're already compromised because you're sick. You're trying to get care for whatever that is about. And now you have to navigate this. And I'm laughing at myself. You have to navigate this with like 1.5 arms tied behind your back. You don't know the lingo. You rely on your insurance company. And some of those people, I don't know, if they know all what they're talking about either, because they're, just trained. I don't know how well trained they are. And it just goes around in circles and circles and circles. And some of the doctor's office and the medical facility offices say, it's a courtesy for us to file the insurance and do all of that, but it's really your responsibility to make sure that this is all up to Hoyle. Well, we don't know what that is. I don't know what it is. I don't know what all of the stuff is, especially if you go in for something that's different that you haven't had done before and you're not familiar with it. I wouldn't even know where to start. I mean, we are relying on them to a lot degrees. I mean, we do get the insurance that we get because we figure it's the best thing for what we might need in the future, but nobody's perfect. There's no crystal ball. On that note, stay listening to Evergreen Media Network.